Hey, good morning. This is Chris from the Cato staff. I'm seeing your patient's not in the room. In a second. Let me see.
Hello.
Hello.
My name is Connor Kelly. I am a second year.
I'm sorry, I can hear. I am going to be portraying the case of Courtney Grimes. So you do have 30 minutes to prepare and get ready, or you can let me know whenever you're ready to start. I'll go ahead and I can place my camera on mute and the speaker on mute. And if you want to just type in the chat, you can let me know when you're ready for me to enter to start the encounter.
Sounds great.
Thank you.
All right. Does someone have the visit agenda thing pulled up?
Yeah, I do.
All right, cool. All right, so let's see, it says the visit agenda and the team create prior to conducting visit. All right, so that's the thing we're doing now. All right.
Do we all want to say what our concerns are and then figure out which ones we want to bring up?
Yeah.
Want me to start or?
Yeah, you can go ahead.
Okay. For like the social work perspective, I would talk to them about missing 3 to 4 doses of BP meds a month and how they can prevent that. Their worries about cost of gym membership, inconsistent dental care due to cost of insurance, feeling disengaged with things they normally enjoy, and then access to healthy foods. Those are my concerns that I wrote down.
Okay. Cool.
I can go next. Just a couple of concerns. She had a recent fall, so I would just kind of inquire on, is that like a frequent thing that usually happens, or it was just like a mishap, just happened one time? Fall risk assessment is a good thing to maybe get done just to check out her stability. And then her physical activity states that her physical activity level is sedentary, so incorporation of some sort of exercise program to raise levels of physical activity would be beneficial. And then she also, for social history, uh, she states that she's disengaged with things that normally bring them joy. So maybe finding out why those things don't bring you joy, and things changed as time goes on. So maybe trying to find something else that brings them joy. Could be anything. So those three things.
I also mentioned like about her. Wait, can you hear me? I'm not sure if this. Okay.
Yes.
But I also mentioned like about her fracture, or not fracture. Like she had no fractures, but she had sensitivity in her tooth, and I feel like that could probably be a big problem, can lead to a bigger problem. So it would be best to like go check that out, and then similar things to like what you guys also mentioned.
All right.
So-
Then, sorry. Did you say have something else?
Oh, I was gonna say, I guess we could go to the part where we like list our major topics, unless there's anything else.
Did the doctors have concerns that?
Yeah, real quick. Parker, you want to go first?
Yeah, so what we put down too, so we've got monitoring blood pressure and cholesterol. We kind of just had, the blood pressure isn't really that bad. I think it's just gonna be kind of maintaining a at-home journal again, continuing to take medication as prescribed. And it's gonna kind of work into some of the discussions already, but kind of access to healthier food when kind of within monetary restraints, eating low salt diet if possible. And then the second concern we had on there was kind of measuring blood sugar and managing their diabetes, since they most likely are having diabetic nephropathy. So it's just going to be working on keeping the blood sugar low, measuring the A1C, and kind of go from there. And so we've got those kind of worked out as well on the that shared doc. So far, I try to type into some of what we just talked about in our kind of just bullet points, what we have so far. So if you hop onto there in that shared Google Drive, it kind of worked out last time too, being able to just type in what we talked about as other people are talking. It just made that post visit a whole lot quicker. So like right now we've got, essentially we get 5 things to talk about. So essentially everyone gets to talk about one thing. And so we've got blood pressure, blood sugar, obesity, cost of insurance, cost of meds, and then also dental pain essentially.
And then like the feeling disengaged, could any of her medications be causing like some depression? Or should I just say like refer to mental health?
Yeah, that one's gonna probably be
What's she on? She's on formogliptin. Yeah, she's not on anything that's gonna cause depression, right, Parker? She's on I mean, if anything, she's gonna have liver failure and muscle pain, but
right. I think
not-
that's more all of these combined together.
Okay.
Like she has difficulty falling asleep, disengaged, COVID. I'd say it's more so those. Generalized fatigue are all kind of some like go together with someone who's kind of
Dysthymic.
required, yeah, mental health concerns there.
Okay.
Yeah, it just sounds like general like COVID blues that everyone has.
Okay.
Or sleep, so maybe like a sleep schedule. Because like, what is she doing before bed? Stuff like that.
Where's the shared Google Doc?
I shared it in the chat.
Oh, in the chat. Okay.
Yeah. All right, and then in terms of just conducting the visit, does anyone want to like start out first or do it? Because like start out, we introduce all of ourselves first, right? And then pronouns, etc. Blah blah. And then does anyone want to lead it or?
Do we each take like one of us start and then do we each take turns talking to the patient?
Yeah.
Yeah.
One person
About
starts.
our like concerns. But yeah, like one person starts and says like, "Hey, what's going on? What brings you in here today? What's going on?" And then they're like, and then patient usually would say like, "I'm here for X like major thing." What's the patient? What's the main concern?
In class, when we start, we also mention HIPAA to them. That's what we've been being taught. So should I start that way? Like, and just.
Yeah, you can just be like, "Yep, everything you say here is
I think that's
confidential."
a brilliant
Don't-
idea.
Okay.
Be
So,
like, yeah.
yeah, because we were supposed to mention HIPAA and the things that we have to break confidentiality for as social workers. That's what they've been teaching us to do. So I don't know if you want me to say that.
That
Yeah,
would
you
be
just
great.
be like, yeah, I think we need to just be like, yeah, everything you say here is between you and me. It's not gonna be outside due to HIPAA, blah blah blah. Perfect. Do they have a main concern? Is this just a follow-up visit?
And
Sorry, what was
they're
the Google Doc? I can't find it in the chat.
I'll share it again.
Okay. It's the IPTV group 43 on WhatsApp.
No,
Oh.
this Teams meeting, whatever, chat.
Oh, okay. Got it. Thank you.
You got it. Okay, cool.
So this was just a follow-up visit. Yeah, and just an
Mhm.
initial scheduled follow-up for the chronic medical conditions. Okay.
Yeah. So I can just start it and be like, hey, what brings you new today? And then do the whole fun little main concern. And then, do we have to take a history, Parker? Do you know, does anyone know if we have to take a history or?
I did this last year, and I will say it's a little different now. But we did not do that. So kind of like how it went last year was you come on, you introduce yourselves, confidentiality, HIPAA, then just kind of see why they're here, what their big concerns are, and then after that, kind of each person just like, well, addressing this issue, like, oh, we could incorporate these things, or we can work on this, doing this. And that was kind of the end of that. So I'm not sure if it's still the same way or how that goes, but
I mean, we can just do that. That's fine. I don't want to take a history right now.
Yeah.
yeah, I don't know.
Semester.
As far as my instructor said, she said to keep it kind of like, don't do it quite like we do in class because we got to keep it kind of short and sweet because we only have like 10 minutes each or something.
All right, perfect. Then, all right, so let's just then cover who's doing what. So I can introduce, I can, let's see. So I can do diabetes. Parker, you want to do blood pressure and cholesterol?
Sounds good.
All right, cool. And Valentina, you're on jaw duty.
I could do I could talk about like her tooth pain and then her periodontitis.
Perfect. All right. And then Kelly, you can help with
What do you think is the most important? I could talk to them about missing their BP meds and like what she can do to fix that.
yeah, I
And
think
then-
you and Dennis at the end would be great. I think definitely talk to her about support for diet and like
Gym
delivering,
membership.
and then like gym membership, and then insurance coverage to continue like visits regularly.
And dental care, yeah.
Yeah, so like regular stuff, and then whatever else you want. I think those are the two main things.
Yeah, I was gonna dive into the kind of tending to the obesity and sedentary lifestyle. Just kind
Cool.
of incorporating, more
If I
physical
wanted to
activity.
talk to her about it, I'll just talk to her about the cost of it, basically. So
Yeah, that'd be perfect.
Oh
she
yeah,
can
also
get, like through Medicaid, sometimes they'll pay for gym memberships and stuff like that. So you can just, or I can just recommend it.
yeah, and
Cool.
then Dennis, about the one thing, did you? I'm sorry, I don't know if I missed you saying. Did you talk about her osteoarthritis at all at her job? It says she works as a factory, like she works in a factory. So I don't know, like what she like standing all day in a factory, or sitting all day in the factory.
Let me pull that up real quick. I know I was reading that works in a factory for a large auto supplier. Yeah, I'd assume she's on her feet a lot, so making accommodations to incorporate time where if she's able to not be on her feet most of the time, or because a lot of jobs will also, if you have some sort of chronic condition, they'll try to accommodate and provide a chair or do it differently just so you're kind of combating those chronic issues that she's battling. So yeah, I could also touch on that.
Just because if you're overweight and then you're on your feet all day, that doesn't go well for osteoarthritis.
Yeah, most
That's not
definitely.
so that
Isn't quick question, correct me if I'm wrong, osteoarthritis gets easier, it's the worst in the morning and the night and then eases up through the day.
Yeah, shorter morning time compared to like rheumatoid arthritis in the morning, so pretty easy, but then worse with use, like repeated use. So essentially you gotta try to find, the only way to make it better is obviously like joint creams, trying to use other muscles that surround the joints to avoid it, and essentially not using the joint.
osteo is degradation just due to overuse,
Mhm.
or like that, versus the rheumatoid is the one that's like autoimmune. So that's like
Yeah,
that's like you get better over day. But yeah, osteoarthritis is like just the joint is
overuse.
just you're just
Yep.
shedding cartilage. So yeah, keep her off her feet because that's kind of like that. Parker, did you want to go over immunizations? I just realized this person's like anti-vax, low key,
Oh, I'd
or is
love.
that like
I think
what?
she's only anti-flu, right?
She's
Anti-flu shot?
She's anti-flu.
Anti. Oh
Was
yeah,
it-
they got COVID.
Yeah, I got COVID.
Perfect.
I'll
Not
just
addressed.
see-
Oh, what about the Prevnar? Are they old enough for Prevnar? What is it, 70?
We can add at the end. Be sure to get your yearly flu shots.
Flu shots, colon screening, mammogram. Because yeah, we don't know anything about so colon cancer screening, and are they female? I'm assuming.
Yeah.
Courtney Grimes.
But I noticed that they use they them pronouns throughout the thing. It looks like
Where is this? Oh,
it
just like
doesn't
throughout.
say. I just noticed throughout it they never said, or it never says she.
All right. Well, when we start the visit, we can ask pronouns, and then be like, "Yep." All right, cool. And then heart attack. All right. So I guess going down. So we have 5 concerns. So for our top 5 concerns and recommendations, because like I guess ending the visit, we got to end with recommendations. So let's see, diabetes, diet and exercise, cholesterol. I just put jaw issues for 4, but periodontitis, or like I guess like mouth care and continuous visits. And then what would be like what do you guys think would be like a big 5th one?
Did we cover some about obesity and sedentary lifestyle? Yeah, diet and exercise. Yeah, I guess that kind of
Do
covers
the
that.
maybe the preventative health just last, because like we've kind of got like managing current things. So we've got like our first thing that we'll recommend is like weight control, diabetic medication. Then we're gonna do like exercise, band work, physical exercise, cholesterol, eating healthy, essentially, blood pressure medication, mouth care. We'll talk about good oral hygiene, and then maybe the last we'll just do like all preventive
Money.
measures.
Mention like difficulty falling asleep and disengage with things that bring her joy. So maybe something like related to her mental health, but I'm not sure if there's like others that are more concerning.
We could have mental health, maybe a diet and
Here,
exercise.
let's do this. Let's just lump diabetes, blood pressure.
Yeah,
Can I do that? I'm just gonna lump diabetes. I'm just gonna say diabetes and blood pressure. You have kidney disease, of course your blood pressure is gonna be crazed. And lipids.
So we said influenza immunization. Did you say colorectal exam?
I mean, yeah, like either like the Cologuard, but like right, it's over the age of 50. You start regular screening, and they don't have anything about that.
I do colorectal.
Also, didn't they say they're like not good with sexual health? No use of contraceptive.
Can I add
and
to the can I add something to the diet and exercise one?
yeah, add whatever you want.
Oh, yeah.
Yeah.
Change of meds.
So for the mental health portion, are we just talking about the finding new leisure activities that bring them joy, that sort of thing, along with
We can do
what else?
sleep hygiene.
Yeah, sleep hygiene, even
Refer
sleep
to
hygiene schedule.
psychology if they want to see a therapist.
Why is this so scuffed?
And depression if sleep difficulties and depression persist. It sounds like depression, like not feeling engaged with things that make them happy.
Yeah.
Yeah, they got like low key depression, not full key depression.
Right.
Yeah, definitely onset for sure.
All right.
Perfect. All right, cool. All right, and then in order. So then all open. And then, I'm sorry, Parker or Valentina, who was going first between you two?
Did we want to go in the order of the sheet?
Sure. So I can do dentistry last, or
Right. Like, do we want to just do it? Yeah. Just to make it easy, so we know like exactly where we are and kind of what we're like
Yeah, we could do that.
talking about.
Want me to
Alright,
go
cool.
at
Then
do you want me to go at the end since mine kind of is intertwined with all of your fields? Can I kind of help with?
Yeah, it's not a bad idea.
Yeah.
Actually.
Okay.
yeah, social work at the end, sure. So just
So I'll
know
go
that.
fourth.
Huh?
So will I go fourth?
Yeah.
Okay.
All right, cool. Then so Parker and I can start, and then occupation therapy can talk about that stuff.
Did we say, did someone say that they wanted to like lead it yet? Like they wanted to be the one to introduce everyone, or?
I can introduce. I
Okay.
can start
Cool.
and be like, "Hey, what's going on?" Cool. All right.
Awesome.
If that's that, then do you just want to message and say we're ready to go?
Let's do it.
If you're
Yeah.
introducing,
Alright.
don't forget to do the HIPAA thing.
Yeah.
Okay.
And are we all good with just finishing up the thing too right after this? Like staying on and
The assignment 1,
Yeah, we have 30 minutes after, I think, too.
okay.
post visit, cool. All right, let's put a message. We are ready. Oh, perfect. I don't have to message.
So,
All right. Hello.
hi.
All right. Are you ready for us?
Yes, I am.
Perfect. All right. Okay, how are you doing today?
I'm okay. What about yourself?
So, I'm doing all right. All right. My name is Andrew Gorman. I'm a second-year medical student here with Wayne State. My pronouns are he, him. And today I'm working with 4 other colleagues. If you guys want to go ahead and just introduce yourselves.
Yeah, my name's Parker Marsh, pronouns he, him, and I as well am a second-year medical student.
Hi, my name is Dennis Wesley. I'm a second-year occupational therapy student. My pronouns are he, him as well. Nice to meet you.
Nice meeting you.
Hi, my name is Valentina. I'm a second year dental school and my pronouns are she, her.
Hi, my name is Kelly George. I'm a social work student and my pronouns are she, her.
Nice meeting everyone. And
Thank
I
you.
am Courtney Grimes, and my pronouns are she, her.
All right. So what brings you to this visit today, Courtney? Is it just a follow-up or?
Yeah, pretty much a follow-up. Also, I'm having this pain in my mouth, like pain and like some sensitivity to like hot and cold. I feel like my tooth is like loose. I 10 days ago, I was at my friend's house and my foot got caught on a chair, and I took a fall. I was trying to break my fall, extending my hands out, to try to grab on a table, and it's a couch that was near it. But I wasn't successful, and I hit my chin during the fall. And I've been just having, like I said, increased sensitivity to hot and cold ever since then. And then my tooth feels like it's loose. I did go to urgent care, and they took x-rays, and there was, no fracture or anything wrong with my jaw, but it has really been bothering me a lot since then.
Okay. And then have you had any other types of like symptoms like that? Any type of like blood you noticed in your mouth or anything, or is it just kind of just those things that you just described?
Just those things right there. I mean, I have had occasional bleeding when trying to floss, but that has nothing to do with this.
Yeah, okay, great. Thank you. And then I would just like quickly to go over your other past medical history as well, if that's all right with you.
Okay.
What we have, just to confirm everything. So just real quick, from what we have on your file, with your just past history, you are type 2 diabetic, with hypertension, dyslipidemia, and then osteoarthritis, and then also periodontitis as well.
Yes.
Is that all?
Mhm.
Any other conditions you want us to be aware of?
No, that sounds about it.
All right, great. If that's all right with you, then we'd like to start just talking about one by one some issues and concerns that we have with you, with just your overall medications, and just get a bit of a picture of your overall health. Is that all right?
Okay.
Okay. So I guess starting off, I just wanted to talk about your diabetes and your management with that so far, if that's all right.
Okay.
So at your most recent visit 2 months ago in the office when we did blood work, we noticed that your hemoglobin A1C is still elevated from your last visit, which is how we monitor kind of how well your diabetes is progressing.
Okay.
And in this case, your hemoglobin A1C is elevated, which means your diabetes is not being controlled right now at the moment. It's still going up, and we want to try to bring that down more. Along with that, when we did just routine chemistry, it looks like your kidney function is also starting to be affected by your diabetes. And so we want to also start talking about that today, as well as how to kind of control your diabetes also, so your kidneys don't drop anymore in their function.
Okay.
And then also just overall how you're doing with your meds, with controlling the diabetes, and your diet and exercise with that as well. So I know last time at our visit, you said that you haven't skipped any of your diabetes medications. You have not missed a dose. Have you had any issues with your current medications?
No, I mean,
No?
with my diabetes medication, I've never missed a dose.
Okay.
At all.
All right. Then thank you for that. And There's no changes to that. And then, are you still monitoring your blood glucose as usual after meals?
I am.
Great.
Yeah.
And how's that been going?
It seems to have been going fine. I mean, I typically really take it in the morning before I eat, my breakfast, and then I take it again, like you said, after my meals. So, I mean, my readings have been, fine.
Mm-hmm.
So, um,
Okay. Well, that's good to hear that you've been following that. And then when you say you take it before meals, how is your diet looking with that? Like, are you trying to get to the healthier foods, or is it kind of just harder for you?
I'm gonna be honest. I mean, I've the past 6 months, I really have been trying to eat healthier. I really been trying to increase my vegetables. I've been trying to decrease the red meats. Um, but it's hard to eat healthy. And not to even mention, you know, the financial portion of it. It's expensive. Just with, the budget that my husband and I have in our household, as much as, we're really trying to buy, foods that are healthy. It's like I said, it can be a strain on us a bit. So I may have to make choices just to be able for, the food to be able to stretch out, which aren't always the healthiest, foods to have. Pasta tends to be able to be stretched out a bit. We may not put as much sauce on the pasta. We may have more of the pasta to fill us up. And I know that that's not good, but I am trying.
Yeah, I understand how hard it is to try to keep a healthy diet and try to keep up with everything when the budget is just not there sometimes. Um, we do have a social work student, as you met Kelly, so she can definitely talk to you about that later in this visit, about what resources are available for that. Um, and then besides the diet, it's a two-way road to control with weight control for diabetes. I know you said you don't, and judging by your budget, what you've told us about, gym membership, I'm guessing that's kind of like not really been on your radar. But have you had any like thoughts about just doing home exercises, doing exercises just in your neighborhood? Has that been something that you've been doing at all, or has it kind of just been still pretty much sedentary?
Um, I mean, I have been trying to exercise at home. I'll be honest, my motivation is very low at home. It's accompanied with, the weather isn't always the best outside, but we have been pretty lucky here to get some decent weather. But I don't really stay in the absolute best neighborhood where I would feel safe to kind of be out there, in by myself. Um, and then the gyms. There's two gyms here close to my home, but they're private gyms, and
Mm-hmm.
they are they're definitely outside of my price range. But I'm trying to get that motivation to do more exercising at home. It's just yet another thing that I'm really just trying to work at.
Gotcha. And with your motivation, have you had any other type of psychological symptoms that you've noticed at all? Like any type of like just like feeling down, not enjoying things recently you've been enjoying at all? Um,
Yeah, I
how's your
mean,
mental health doing?
honestly, it's been, you know, I actually have not had joy in doing a lot of things for a little while now. And it's just like since this pandemic, it's just I just can't get that motivation, to want to do things, that I normally have enjoyed. I'd really love to read. And you would think with being down with the pandemic, I would have, had that time to kind of read more, but I've just been so disengaged and just cannot get myself out of this. this feeling.
Okay, I'm sorry to hear that. That's how this is. It's been it's not uncommon to feel like that, especially with whole COVID. I know a lot of people are struggling with that kind of motivation. And when we have an occupational dentist, he can definitely talk to you about motivation and ways to help cope with that mental health issues, and also referrals to therapy if needed. Besides all of those, I believe, I guess, and then just going on with just managing all of this together, kind of just to wrap up what we just quickly talked about. Again, with your diabetes, as I mentioned earlier, the biggest thing that we want to focus on is going to be your weight control. So again, the diet and the gym, and Kelly and Dennis can both kind of provide more information on how to help you get those resources and what kind of exercise you should be doing. And then in terms of what you should be doing as a follow-up after today's visit, I would also definitely consider going to your primary care physician and looking at a medication review about, because if you do say, as you said, you're taking your diabetic medications you don't miss a dose. So definitely going there and getting a medication review with your primary care physician about possibly changing some of your diabetic medications or adding a new one can definitely help that get more controlled, and reduce any other risks that may be happening. And then Parker, I believe you had a few more things you want to talk to her about her overall health.
Yeah, hopefully. So kind of going off of that too, we're going to talk a little bit more about some of the medications. And so I understand that you are taking medications currently for hypertension. Is that correct? And then, which ones exactly are you taking?
I'm gonna be honest. I take so many to like differentiate what is for what.
Yeah.
It's kind of hard. I take a lot of stuff.
So in our charts, we have amlodipine and benzopril. Is that correct? Does that sound right?
Yeah.
And it's about 5 and 20 milligrams by mouth in the morning.
Yes.
And have you been taking it every morning?
I mean, yeah, I've missed some. I mean, I don't miss every single day, but I may miss once a week.
Okay. And I guess so. Like, what's the main cause for missing a dose, would you say?
Honestly, just I think because I take a lot of stuff as it is. I am up at 5:15 every morning. I have to be to work at 7.
Right.
You know, every morning is not the best morning for me as far as getting around. I have these pains in my knee, you know, from my osteoarthritis, you know, then with the recent fall, and that's just recent, but just I think just my daily life, like even just with my body, just sometimes my body affects my mental and I may forget things
Right.
like that.
Yeah, absolutely. I think it can become pretty difficult, especially when you're managing more than one medication and working with a pretty busy schedule. I know it can be hard to kind of just remember to do that every morning. I think one of the things, and we're also looking kind of as your blood pressure trends. I know we were having you kind of do a blood pressure log or journal, right? Taking your blood pressure at home. It's like your numbers have been averaging within a range of 130s to 150 over 70 over 90, which is actually pretty well maintained. I know it can be difficult to kind of maintain blood pressure. The ideal range is obviously going to be closer to like the 120, but 130s are even to a good goal to have. And that constant blood pressure monitoring is excellent just to be able to see where you're trending. And it gives you a good idea of where you're headed. And this kind of goes in line with a lot of what we've been talking about so far. A lot of the lifestyle changes and the diet play a really big factor into your blood pressure monitoring. I would obviously recommend one of the first things too is, do you have one of those the kind of categories for like to put all your medications in for each day? They usually have like a little container. It has a Monday, Tuesday, Wednesday, Thursday, Friday.
Yeah. I've seen them when I've gone to like the dollar store, but I've never really thought to even grab one.
Yeah, no, I know. So for instance, I know a lot of patients have been successful using those, and it's one less thing to kind of have to keep in your head. Instead, you might just be able to say, okay, every Sunday night, I just fill these up, and then it just sits on your nightstand, or right when you wake up in the morning, when you maybe wash your face before you head out to the door, you'll just see this container, and it has all of your pills already laid out for you. I know those can be really helpful and takes a little bit less off the mind and off the plate, especially for people that really have early mornings and quick mornings. But then kind of going off of that, talk a little bit too, we did talk a little bit about the exercise, which we're going to go into a little bit more later on. But I would just like to say that and talk about the overlap. Kind of the physical activity and diet do have a really large overlap. And so I think as we get to the recommendations later on, we can talk a little bit more about how you can hit both your blood pressure and diabetic control with the diet and exercise at the same time.
Okay.
Yeah. Do you have any other concerns as it relates to your blood pressure? Have you been noticing any kind of faintness, chest tightness?
No, not really.
Okay, good. And then, so do you feel, if you, let's say if you didn't have blood pressure medication, would you feel like you have any concerns as it relates to the blood pressure?
I don't think so. No, not
Okay.
really.
Great. Well, awesome. Well, I'll hand it off to my next teammate, but thank you so much.
Okay, thank you.
How are you, Mrs. Grimes?
Hi, I'm okay. And yourself?
I'm good. I'm like I said earlier, I'm Dennis. I'm a occupational therapist, year 2. So I know you mentioned previously with my colleague Andrew and Parker that diet and exercise is an area that you would potentially like to increase as it leads to increased levels within your blood pressure, as it has a huge impact on that. I know you're not too fond of going to the gym. You'd rather be in your own home at your own leisure. And motivation is also a big factor. So I personally would recommend incorporating some sort of exercise regimen. It could be in the comfort of your own home. You don't need a ton of equipment or anything to get a good quality exercise as long as you follow the regimen. There's a ton of resources online in newspapers. You can get them anywhere. I know my colleague Kelly can also touch on that, but incorporation of like the TheraBands, that's honestly a great piece of equipment. Calisthenics, a lot of body work that doesn't put a lot of pressure on your joints, as I know you are have osteoarthritis. So incorporating some sort of uh, exercise regimen that you could find like on YouTube, just simple body work that you could incorporate one time a day, like after work. I know you get home at around 5 p.m., I believe you said.
Yeah.
Being able to like just participate in some sort of physical activity for whether it be 30 minutes, 40 minutes, 3 times a week, 2 times a week, you can always gradually build up on that. But if we increase those physical activity levels, plays a big role in your blood pressure, aids in lowering your blood pressure. And I know that you were having issues with your left knee, and your surgeon said that you could be a potential candidate if you lose 20 pounds, that you could get that surgery done if you were wanting that for your knee. So that would also be huge in getting you to that 20-pound weight loss goal in order for you to get that surgery done.
Yeah.
So we could, like I said, Kelly can touch on more of that, but definitely getting more physical activity in on a daily basis, whether it be by yourself or maybe even incorporating with your husband. I know your husband has a stressful job, but low physical activity is great for everyone. So even if you needed a company, you and your husband could participate in that as well to make it a little more enjoyable. Um, and then my second thing regarding mental health. So I know you mentioned that you have not been enjoying as many things like you once did, like reading, drawing, those types of things, like lack of motivation there, which is very common for everyone, especially after the COVID pandemic. Um, the thing is, as time goes on, everyone gets new things that bring them joy, new leisure activities, change weekly, monthly, yearly, whether it be by yourself or with another person. But being able to find something that could interest you, that you could see, like you could get excited to after work, like, oh, I'm gonna go home and read this book with my husband, and or oh, we're gonna watch this movie and it's gonna be a great time. So what's the real reason? Like, why do you not find yourself enjoying books anymore? Why don't you interact with those things anymore?
I wish I could could explain it. I'm gonna be honest, I don't really know. I just know that I just don't want to. I mean, it's not even just that. It's even the relationship with me and my husband. You know, we're we we're still sexually active, but the interest even for both of us has kind of gone down since the pandemic. Is we're around each other and spend time together, but that intimacy like is not of any real urgency or importance
Right.
for either of us. So I don't really, all I keep, kind of can refer it to is just like I don't know. I don't know if maybe just all that time inside during the pandemic kind of just
Mhm.
made it, once the pandemic has kind of eased up a bit, that maybe we should have more motivation or be excited about doing things, but it just hasn't come.
Okay. Well, I would maybe recommend. I know during COVID, obviously you're locked up in your house with your significant other or family. Um, Maybe incorporating something, since you and your husband are in the house after a work day, maybe trying to find some sort of activity. Could be anything, getting food together, making food, puzzles, drawing, movies, shows, maybe trying to find something that both you and your husband could find enjoyment out of, and then maybe incorporating that, a couple times a week after work, um, just so you can actually relax and enjoy your leisure time. Because I also know you work every day and your husband works every day, so just having a sense of relaxation, finding that something that both you can do would be very impactful. Um, Another question for you. Do you find that your sleep schedule or sleep hygiene is an issue to you, or do you find that, I know you mentioned you wake up at 5:15 in the morning and then get to work at 7, and you typically go to sleep at 9:30 about PM. Do you find that that's an issue? Has it been working for you, or would you like to change that a little?
I really would like to be able to actually fall asleep. So, I mean, I get in the bed, but I can still be up, for an hour or two, and that's
Okay.
like, detrimental. That means I'm really sometimes not getting to sleep till 11:30, 12 o'clock, and by the time I blink, my alarm is going off, and I'm having to get up, and just start my day all over again. Um,
Okay.
so yeah, I am. So I'm tired, and things like
Right.
that because I'm not really getting as many hours as I really need in order to do everything that it is, like I said, just my job, period. You know, I'm not rested
Mhm.
enough even just for that.
Um, I totally understand that. Definitely. So for everyone's a little different, but typically 6 to 8 hours of sleep is what's recommended for someone to like fully recover on a nightly basis. Um, so personally, I would recommend. I know you're having troubles with getting to sleep, whether it take an hour or two, maybe getting into bed a little earlier, whether it be 8:30 p.m., 9 p.m., along with Parker and Andrew could also talk on this, but maybe incorporating some sort of supplement of trying to get you to go to bed a little faster, like a melatonin. They would know more about that, but maybe some sort of aid to get you to sleep a little better.
Okay.
Um, and then uh, the 5:15 wake up
We only
and
have 5 minutes left, just so you guys know.
oh, oh,
So we might want to
okay.
move forward.
Yeah, I will. I will. It was very nice talking to you. I'm gonna pass it on to Kelly, and she'll dive into some more things. Nice chatting with you.
Nice meeting you.
I think Valentina wanted to talk to you about your dental affairs.
Yeah. Hello, hi, Miss Grimes. I'm Valentina, so I'm gonna talk to you about your dental care and then some other things. So I noticed you said that your last dental visit was March 2021, and you had periodontitis, multiple extractions, but you had to delay those extractions because your blood pressure was too high.
Yes.
Okay. And then it also mentions you don't floss regularly because you feel some discomfort or occasional bleeding. Is that
Yeah.
right? Okay. And then also I see you hit your chin. Uh, how's that doing?
It's still bothering me, but I'm here.
All right. And your jaw pain, do you still feel a lot of pain or has it been progressively getting better?
I mean, I've been taking the naproxen. I take for like my knees as well sometimes. It's been helping with my mouth. So I think just like I said, I think I take like acetaminophen, I'm sorry, for my knees, and I take like the naproxen for my mouth, and it eases it up. It's more the sensitivity is really bothering me more than probably anything. Like I said, my tooth does feel loose, but that sensitivity is getting to me.
Okay. And has it been affecting things like your sleeping, your talking, or eating,
Pretty much my eating and drinking.
eating and drinking? Okay. Do you notice any swelling or redness, discoloration in that area?
No, not really.
Okay. Uh, and I think so. For the pandemic, did you feel like you neglected from your oral hygiene during the pandemic, or how was your oral hygiene maintenance during then?
Um, I don't feel like I neglected. I've always brushed my teeth twice a day. Excuse me, and I've always used Listerine mouthwash. It's just that flossing portion has always been um, you know, something that I really wouldn't do much. I don't like the way it feels. Even before the occasional bleeding or even before the discomfort, I just never really liked the way the floss feels going in between my teeth.
Okay, so it would be discomfort and bleeding. That would, I see. Um, I noticed your last dental visit was March 2021. Is there a reason why it's been since then?
Honestly, I have dental insurance. I don't have the best dental insurance. And some of the things that had been suggested to me that I needed to be done, some of those things, the copay, my portion was large, as far
Yeah,
as versus what the insurance would pay and what I would pay. So it's just like monetarily, it just didn't fit into my budget.
I see. Okay. So I think my main goals as of right now is that we have to give you proper oral hygiene instructions where basically I'm gonna, depends on your preference. If you prefer brochures or a video or just me demonstrating, I could show you, how to floss or ways of, properly brushing just to make sure that we're properly, doing that oral hygiene care. And then I could also talk to you about diet, where regarding your snack and drinking, just to make sure that we maintain, what you have right now, so it doesn't get worse over time, and trying our best to see if we can find a dental care, before things start to get worse.
Okay.
Mhm.
I think, yeah, all of that sounds good. Brochures sound good. It'd be nice to be able to find some affordable dental care for me.
Mhm. All right, I'll give it to the next person. Thank you so much.
Okay, thank you.
Hi, Courtney.
Hi.
Again, I'm your social worker. So I just wanted to go through some of the stuff that you've talked to our team about.
Okay.
One of the things was I know that you are worried about cost of a gym membership to be able to get some exercise. I was wondering, can you tell me a little bit about the community you live in? Are you in Detroit?
Yes, I am.
Okay. I did want to let you know that like YMCA of Detroit, they have like a low income plan where it's based on income. You can apply and they'll give you a lower rate. It can even be $1 for gym membership if you're interested. And then when you turn 65, I wanted to let you know that if you can apply for Medicare, and they have a program called Silver Sneakers, so you can get free gym membership through that.
Oh, that'll be nice. Well, I'll be 65 soon enough.
And like Dennis said, that you can also do stuff in your home. I know that you said that you don't find joy in the things you normally do. I was wondering, can you tell me, are there times right now that you do find joy in anything? Can you think of moments of joy recently?
um, when my son FaceTimes me with my grandkids, that's one thing I can think of.
That sounds nice. Have you been to visit them?
No, I haven't.
No.
No, they don't live here. They live in Cleveland and just haven't, haven't been.
Yeah. Do you enjoy, do you have any hobbies you enjoy with like outdoors, gardening or anything like that?
No,
No?
not really. Not really, no. Not outside, no. Pretty much of an indoor person, but yeah,
Oh.
no, not really.
Sometimes when you get some exercise involved, like with your hobbies and stuff, they can kind of help with like feeling down as well as like help with your health. So it might be good to just get outside with your husband every now and then and just get some fresh air and stuff. If you're and then I wanted to talk to you about access to healthy foods. So do you currently have food assistance?
No, we don't
No,
qualify for food assistance.
you don't qualify. Okay. Um, and then do you have much access to healthy food in your neighborhood?
I mean, I usually drive to, well, Walmart isn't real close, but it's not real far either. I know where we lived before, there was like a fruit market near us, but the neighborhood that we live in now, there isn't like a fruit market near or anything for me to go to.
I don't know if you know, but Detroit has a lot of community gardens as well,
Okay.
that you can participate in, and then also there, I can give you a list of some drive-through food pantries. You might be able to pick up some healthy foods through that too, to help cut back on the cost of fruits and vegetables that you're spending in the grocery store.
Okay.
They
I'll
even
take
have,
that.
okay, yeah, and there's even one called Capuchin where you can go in and grocery shop for yourself. So you can pick your own stuff.
Oh, okay.
And then I wanted to talk to you about your missing doses of BP meds. I know Dr. Marsh talked to you about it as well, but I just wanted to let you know it's pretty important that you don't miss them. So that container he was telling you about with the Monday through the Sunday through Saturday, they have ones that have AM and PM. It's a really good idea to do that. It just helps you like stay organized so you don't miss those doses so that your overall health will be good. And I know you mentioned that you don't know the medicines and what they're for. If you take, I know some other patients I've worked with take in a note card and you can sit with your provider and you can have your list of medications written out and what the reason is for taking it and the dose and keep that in your purse so that you know.
What they are.
Mm-hmm. Yeah.
Okay.
And I was just wanting to talk to you more about can you tell me, I know we're running out of time.
Yeah, I was gonna
That's
say
why I'm rushing
they're
really
gonna
fast.
they're gonna kick me out in a second, but
Okay.
go ahead.
That's why I was trying to rush through everything.
Yeah. Okay.
But, but yeah, and then you can also try to apply, I don't know if you'll get approved, but you can try to apply for Medicaid as a secondary insurance to help with the cost of your copays and with dental and healthcare. If you've done that yet.
Definitely look into those as well.
Okay.
All right. Okay.
I didn't know if our time was up.
Yeah. Yep. Our time
It is up.
I was gonna
Okay.
say, yep. I've gone over 6 minutes now, but
Sorry, I would have asked you more, but I was like just trying to rush through it. Thank you.
I understand. All right. Yes. Well, it was nice meeting everyone.
Nice
Yeah,
meeting you too.
Okay. Have a great day.
Thank you.
Yep.
Bye.
You as well.
Well, that went by quick.
Yeah,
I thought we had
I'll-
45 minutes.
I
That-
thought so too.
Was that not
You were-
45 minutes?
No, that was
No.
like 30 minutes.
Oh,
Because
well,
she said
it
she went over
definitely
by
is
6
45
minutes.
minutes.
Yeah, we only had
It
30
says
minutes,
45.
so by the time
Oh.
it got to me, I only had like 3 minutes. So I was like,
I don't know
oh,
why.
that's
Yeah,
why I
I'm on
was
the
just rushing
orientation
through.
page. It says the entire visit will be an hour and 35 minutes.
Mm.
Huh.
So we had an hour for the pre-visit huddle, or I mean 30 minutes for the pre-visit, and then 30 minutes for post-visit debrief.
What do we do
So I
during
was-
the post visit?
We do the assignment 1.
Yeah, we just finished that.
So we finished the visit agenda. So make sure you just fill out your part for the visit agenda, and then we do the assignment 1.
Yeah, if everyone wants to make sure, just like for the that shared doc we already have already, that the visit agenda is done for your part, that would be great, and we can move on to the next form. Looks like the only part we need to kind of fix is the
4th mouth care,
mouth.
and then also make sure you just finish your interprofessional team collaboration.
Right, essentially your role down at the very bottom.
Cool. Let me see what the next assignment is. Yeah. Also, I'm really sorry. I completely missed the HIPAA thing. I was like, I'm gonna say it, and then I just didn't say it.
Oh,
Yeah, I was
It
like,
happens.
I'm gonna say it, and then I was like, all right, what's
Looks
going
like
on?
I got copy and paste a lot of this.
I didn't do any of the kind of things that we practice in class because it takes too long, where you like let them explain more stuff, because I was like, let me just get through these really fast.
Yeah.
Yeah,
Oh,
this
yeah.
is 30
better
minutes
in-
was not enough time.
I mean, yeah, I was thinking 45 because I was gonna be like, all right, so we have like 15 minutes left. I'm gonna wrap up because I was like, oh yeah, and then we'll do a wrap up too. All
Yeah.
nice. Because I fell back on the habits also from class because I was like, all right, let's start, and then I was like, wait, I don't have to do the whole. Because I was about to do whatever the brings you here, pain, radiation, severity. I was about to do all that, and then I was going to do a history, and I was like, wait, I don't have to do a history. Why am I doing this? All right, patient care plan.
This is the patient care plans due on the March 26th, I believe.
Yeah, that's the things that we have to submit for assignment 1. So the assignment 1 is submit 3 uploads. So the visit agenda, patient care plan, and reflection.
Okay. We might as well do
Is
the
there-
patient, the reflection, or do you have to reflect together?
That's what I'm thinking. So because it says there should only be 1 submission per group.
We
So I
could,
don't know. Is the reflection?
we could just meet up at some point and do the reflection together on Zoom. Like, I don't see an issue. Up to you guys. I'm talking about for the reflection portion. The patient care plan we can do now, but or we can do it all. I'm up to you. I have class in an hour though, so
Gotcha. Yeah, we can crank out the care plan.
cool.
Is this one that we're filling out the one we submit, or the care plan?
We submit both.
Oh, both.
Yeah. The care plan looks like a lot of it's going to be copy paste from our visit agenda.
Oh
I mean, that's
yeah.
what I remember it was last time.
Yeah. So I think, honestly, I think this is going to take us, like, if we did, it'd take us like 10 minutes. Coleman, do you want to copy and paste this patient care plan into a Google?
Yeah, let me get it into a doc.
Cool. Reflection real quick.
Yeah, the visit agenda looks pretty good. I think it's
OT2.
pretty much changed or filled out. Valentina, I am gonna change the discipline for the bottom thing. It says mouth care, but I'm just gonna write dentistry.
All right,
I'll make
let's see how
I'm just
Scott
gonna make a
looks.
reflection doc too real quick, and I can send it.
Let's upload. All right, let's see. This is not what I wanted.
I don't know why this won't go onto page 2.
All right, this is what I want. Share.
You said you were gonna put it on the same Google Doc at the bottom?
Oh no, I was gonna just make it because I think we have to submit new things.
Gotcha.
All right. So Parker, you made the. All right, that should be the. All right, so patient care plan. So
All right, so yeah, now everyone should have in there essentially the 3 things we're going to submit. The visit agenda is done, the reflection, and the patient care plan.
cool. All right, so how many do you have to do? You'll identify 5 concerns, goals, and then 3 healthcare disparities. Sounds Gucci. Can I get rid of this? Actually, I'll just use it as an example. Let's just can't spell.
We could just
Cool.
use
And that's what I was saying. Like, can we just copy that and just delete it as like the great thing?
I'm just gonna edit parts of that, to be honest.
All right, so let's just unfill that.
I feel like this is a lot of copy pasta.
Yep. Oh yeah.
What's a goal for diabetes?
Lower.
Doctor, what do you think is a good? Yeah, but like they want us to have, I guess, a physical, like they said, like decrease blood pressure by.
You want to get below 6%.
Is that like something that's doable though for a diabetic? I feel like that's something like I've never seen like an actual like person. It's not like that's type 2 be below 6%.
That's just because those are questions from UWorld.
In the real world, I feel like every time I see a diabetic, they're like, "Oh, yep, it's uncontrolled." Especially at DMC, every first time a diabetic came in, the HbA1c was like, "All right, we're gonna control it." It's like 10%. You're like, "What is this?" You're gonna have a great time at DMC.
Looking forward to it.
Are you guys year 3 or 2 medical students?
About to start 3, but technically I
you-
haven't started yet.
Do you know who Ben Huber is?
I don't know him personally.
No.
The hard
I'm kind
part
of
is
a hermit, so I don't really
we went
know.
virtual right away, and then we've got 300 in our class.
Oh, geez. Okay.
Yeah, so it's not exactly. It's kind of hard. It's pretty hard to like end up meeting a lot of the people just since most of your interactions were like first year on Zoom,
Gotcha.
unless you were in like a lab group with them.
Just gonna steal these dietary recommendations for your blood pressure and make those mine. Here, let's just decreased intake of what the fuck?
That's not great.
What just happened?
You didn't paste without formatting.
Uh,
Or right click.
That's on me.
I'm gonna take number 1 from that. I'm doing the obesity increasing physical activity levels.
I feel like everything we talked about it can be managed by exercise.
Yeah.
Mental health, exercise. Blood problems, exercise.
Yeah.
Mouth pain, exercise. Fruits,
Oh,
veggies.
I'm literally just gonna copy this entire thing. What?
I know, right? That's what I'm doing.
What the heck?
Let's just add STI. A1C.
All right, so hypertension is done. Diabetes just about done. Obesity, physical activity levels looks pretty good. We'll just need to put in there
2 more for care
Oral-
plan and then
oral hygiene
disparities.
and
I guess oral hygiene and monitoring. I mean, or whatever, routine care. Routine oral care.
and
And
then
then,
is the last one like social work? Is that what are we
well, oh, mental health.
mental
Let's do
health?
that because I feel like social work is going to be like
Yeah, all of them.
mental health and sleep.
You want me to
Because
just
disparities, I feel like.
Do you want me to just add something in each of the boxes for social work then? Like in the recommendation boxes?
Right.
Yeah, but I think that's perfect. Because I feel like you kind of, social work is just kind of like involved in all of this. And then it's definitely healthcare disparities. The second part, I think, is a lot of social work because it's like food insecurity, insurance insecurity.
Did we make a healthcare disparity one on the, oh, down,
No, that's the
Right.
second part.
keep scrolling.
Yeah. Who's anonymous dragon? Who's working on the mental health one right now?
Yeah, that's what I'm working on right now. I'm putting, like
That's you.
maintain like sleep schedule. Maintain consistent sleep schedule.
Or not. Electronics, coffee. Yeah, you got that. Refer to. Let's just change. I'm gonna take the physical activity one again and put it in here.
Yeah.
I'm just waiting for the mental health and sleep for the goal outcome. Just achieve a quality 6 to 8 hours of sleep, right?
Yeah, maybe. Yeah. Keep a mood journal. Keep a sleep journal. Keep track sleep. And then let's see what. Ramultolin.
Yeah.
No, we'll give straight benzos. Haloperidol. Oh, single benzo.
Melatonin. Just do 3 milligram melatonin. Or do baby. Do the
Baby.
option.
Baby melatonin.
They make baby
I don't
melatonin and that actually works pretty well.
I don't even know
don't know
why I
the-
brought that up, honestly. As I was talking about it, I was like, she needs a melatonin.
Just have off the cusp. That's all right.
I
I
didn't
was
know how
doing the
much-
same thing.
I didn't realize how much melatonin helps. Like I was taking a tiny like baby dose one, and then my husband went out and bought some and bought the 12 milligram one. And I didn't even think about it. I just took it and I slept all night. Then I woke up, went back to sleep an hour later, like half
Oh,
a day. I was like, dang.
I like started doing like mostly like the 10 ones And then I was like, you know what? I probably don't need 10. We should probably try to cut this back.
Yeah, now
Let's
we already have
see.
the 12, so I just break it in half and take
Yeah.
half if I need it. I did not know how strong it can be when you don't take other medicines. So
Get some good sleep, some good dreams usually.
Okay, I don't care about this.
there's one they give pregnant people to help them sleep that helps with, or to help with nausea, but it's also sleep medicine. Unison.
Oh,
That
okay.
gave me some weird dreams. I was like, what the?
What's happening?
Let's see, pharmacotherapy, drug selection.
What should I do for oral care? So they said they brush their teeth twice a day. I guess like to continue to brush teeth.
Valentina, what are your recommendations? Floss?
I think flossing, because she needs to know like proper oral hygiene care. So I think like giving brochures or videos, stuff like that, just to help her out.
All right, let's just do Ramiltoin. Let's just get that done.
Checking with OT surgeon. Is that it?
Did we do the disparities?
Oh, there's a bottom part. I didn't see that.
Let's just say 5 million. Three, five, right.
Trying to think of another
Healthcare disparity,
food
cost
insecurity.
of medical care. Yeah, like food insecurity.
Yeah. Cost of what did you food security?
Yeah.
Security.
Oh, we've got
Food-
up top.
I just
Oh,
copied and pasted it.
oh. Never mind.
I added a couple things I was putting in there. But yeah, food insecurity is one the example one.
Shh, what example?
Oh, I think it just got deleted.
It's the bottom one now.
Oh, it's the bottom one now.
Yeah, we didn't plagiarize at all. Wow, great ideas, guys. Food insecurity.
Do we have to have like a specific amount, or is it just whatever? Yeah, I guess it could be however many. Are we just gonna do those 3 disparities? You think that's good?
That's all we need. We just need 3. It says 5 concerns assessments and then 3 healthcare disparities.
Okay, cool.
So we're all good. So food security, neighborhood and community events. It doesn't say how many recommendations we have to make for each one. It just says, 3.
Yeah, we have 3 to 5 for all of them, so I think we're good there.
I'm kind of writing some stuff in the reflection too right now that people can feel free to just add on. But I've got.
We have to answer one of those questions, right?
What's up?
It says we have to. Which prompt did you choose to respond to?
Ah, I didn't even know there was prompts.
There's 4. There's 4 prompts.
Fuck, where are those that I somehow missed?
Under assignment 1, it's like the reflection, and then it says like respond to one of the following prompts below. Explain the advantages and challenges.
I'll copy and paste it into the doc.
Alright,
And then we just
cool.
have to respond to 1.
I did some pretty broad sweeping things, so I'm sure it's
You can just leave that, and we can just answer one of these prompts.
yeah.
You just wrote a good intro.
If
Alright,
this
cool.
decides to work. Oh, I can't edit this. I have to.
Reflection. Oh, we got a request. Can
Yeah.
you change the sharing, Parker?
I made it so whoever had the link. That's kind of weird.
I just requested.
Yeah, I can. I'll make sure. I'll go to my Google. Make sure everyone can get in.
I thought I was going crazy. I was like, why is this not working?
For follow-up for the mental health, should we put that you'll follow up to see if they attended therapy or something? I was trying to think of a way to word it.
I guess refer for therapy. So that'd be like something we could
Yes.
do. Refer to psychiatry.
It's working now, Parker.
Okay, cool.
Those are the
And then
prompts.
just check up and on, yeah, I think just check up next visit. Be like, hey, how's it going? Psychiatry, all right, reflection. Does any prompt catch your eye for the reflection?
Honestly,
I like
what I
the
think
third one.
the barriers. You like the barriers that hinder?
I was just gonna say time.
Time we put in there, definitely.
I
Yeah,
was just
time
gonna
was
be
a
like-
huge one.
Honestly,
I feel like you could
we
probably
already
just-
have what we have works well with the first one, since it has advantages and challenges. So the time, like our barrier was the time. So like that can be like trying to like, and I already put it in there, engage, difficult to thoroughly engage in all topics in the window.
Yeah, because I guess you don't know how much time each other like specialty wanted, so it was hard to say. Perfect. Great advantage to provide.
Where are you
gonna
guys
say-
saving this stuff? Is it on the side?
It's
I'll
a different
post it.
Google Doc. It's the, I think Parker posted. It's the one that Parker sent in the chat.
The first one or the
Just sent it.
Just the one that Dennis sent.
okay.
I was gonna say it was advantageous to have other specialties that can address patient's concerns that were out of our scope.
They really should have gave like 15 minutes per field or something.
Yeah.
That was like nothing. I guess we all only had 5 minutes to talk.
Well, yeah,
Yeah,
I
it
was
was 30
talking and
minutes.
then someone raised their hand, like saying there was 5 minutes. I'm like, wait, what?
Yeah.
I don't know, because I wasn't going. I did like I tried to do like around 10 minutes, I think. And then I was like, and so I thought I was, and then they said 5 minutes. I'm like, oh, I just go over it. And I definitely went over my time, but
What field of medicine are you going into, you guys?
Sure. Yeah.
Area.
Still got to iron some things out.
Yeah.
And in rotations, I think.
Yeah.
I got to get to rotations. I'm not,
You know what
even
you
out
like,
of the
though?
second year waters yet.
You know what you like though? Like peds or adults or
Definitely leaning towards adults and kind of like a surgical specialty. Kind
I'll
of.
see there's a lot of school to do.
Yeah,
for
definitely got
surgical.
some school to do and some tests to perform well on before we can fully commit.
One nice thing about the social work field, when you're in school, it's like essay heavy. So you don't have a ton of tests. You have a ton of essays.
Oh, okay.
So
Yeah, that's pretty true. We haven't typed an essay in God knows how long.
yeah. We do have the big
Well, we
test to
have an
get.
essay due,
You do?
don't we, Parker? We have to like read a book about resilience or something.
Oh yeah. There's some of those.
They give us fun little writing assignments from time to time. That it's like, huh?
Yeah.
Very
We
sure.
have the big test after we get our when I'm done with my master's, then I have the test for get my license. So
Yeah, that's probably.
but only a few of our classes so far. I'm almost done with my first year of my bachelor's degree, like my junior year, you know. So I haven't had any
Mhm.
tests yet in my junior year. Kind
I
of
would take that.
Nice, yeah.
All right.
Parker, I still can't edit the IPTV thing.
You gotta refresh. It works.
Okay, let me refresh it. Let me just open this in incognito tab or something. All right, mine's still being wacky. Okay, I'll just.
I shared it again, or like shared privileges with you.
All right, now we're good. Thank you.
I literally made it so it's like anyone with the link
How long
can
does this have to be?
edit that. I don't know.
I don't think there's a
Is there,
specified length.
is there like no word count? Cool.
I don't think I can edit either.
Challenges. I would say this was hard though, because I mean I felt like I was stepping on you guys' toes when I was asking questions, because I was like, oh shit, this is what social work wanted to talk about.
One thing it helps you learn is how intertwined all of our fields are together.
Yeah.
I know. So it's like I didn't want to like encroach on your guys' things. So I was like, oh wait, they can talk about this.
No, it is nice.
Yeah,
especially
and
'cause you're like, oh, you should go get a gym membership. I'm like, normally it costs like $120 a month, but Kelly's like, no, for free. You're 65. You're like, that's huge.
Yeah.
Like that's, I mean, even like this, like I don't know, this mock patient, like their biggest threat to their health was like food security and like safety and stuff like that. So like it was all the intangibles.
One thing that helps is I got last year I got a job working for the city of Detroit, so it helped me like learn some resources already because I'm a community health worker while I'm going to school. So I get to go out and meet people and help them with this type of stuff. So
That's huge. I think it's a huge help for them.
it's been helpful for school. But like even surgical and dental, like I know when I used to work as a nurse aide in the hospitals, the surgeons would give a referral for dental because dental is important so they don't get the bacteria from the mouth during surgery into the body and stuff. So I didn't even know all that till I was working as a nurse aide.
Yeah, I think definitely helps to have everyone working together. I mean, in theory, things sound good, but if you can't really put those pieces together.
Yeah. I never thought people need directions though to brush their teeth every day prior to surgery, but I guess some people don't brush their teeth daily. So
you'd be amazed. We have two different like we have a level 1 and level 2 rotation. And one of my level 1s was at the VA, and a lot of them, suffer with depression, PTSD, Section 8 housing, all the above. And like we literally had to like go to Section 8 housing and teach these people how to do their laundry, do this, clean their place. It's wild.
That's hard.
yeah. Do you all work and go to school?
Definitely.
A little bit, yeah.
Yeah.
All right. How's everyone feel on the reflection? Anything else people want to add?
Did we put in there about learning about how all of our disciplines go together? I don't have editing access, so I can't write anything.
But I
That'd be a
think
good thing for the
or like it kind of came through my email, so you should have access now.
I just read through. I think we hit everything in it.
Cool. Just like that. All right, great. Assignment 1. So let me just double check everything's good. Is everyone happy with the visit agenda?
Yes.
Yes.
Yep, looks good.
Perfect. Cool. Visit agenda's done. So let me just save that. I can submit stuff. Why is the the visit agenda is so winky though, and it's like format?
Yeah, I tried fixing that, but I cannot figure it out.
And now we have like headers and stuff. Whatever.
It's all right. That's what.
Oh, it's on
That's their problem.
page.
I'll just say it's on their end.
Jesus.
All right, IPTV. Everyone happy with patient care plan?
Looking at it, let me make sure.
1, 2, 3, 4, 5. Filled out. Looks good to me.
Perfect.
Yeah, looks good.
All right, and then I'll go with reflection. Get rid of the prompt.
Yeah, looks good.
There we go. Now it looks good.
Perfect. File download. All right, let me submit all these. So there's your one submission. Should have 3 total uploads. Yeah, okay.
Sweet.
Boom. Add another file.
And then I think after we submit all these things, there's a couple surveys that you have to do. My buddy was just in it too, but that's individual, just as an FYI.
Right. Yeah. The post-visit survey assessment, year assessment.
All right.
Yep.
All that's submitted for assignment 1. All right, cool. So now I'll just do post-visit stuff. Post-visit requirements. Let me just double check. All right, and that's all individual.
Yep.
Survey,
Yep.
and then team assessment and peer assessment. All right, cool. Perfect. All right, cool. That's all done. All right, cool.
Awesome.
Anyone have anything else?
Cool.
You said you were gonna submit it, Andrew?
Yep, it's all submitted. Everything's all set.
Perfect.
Sweet.
Well, nice meeting you all.
Yeah. Nice to meet you all.
Mhm.
Good work.
Alrighty. We'll keep in chat.
Yeah. Have a
All
good
right.
rest of the day, everyone.
Thank you. See
All
you
right.
guys.
See you guys.